Hello guys, today we are going to discuss about diabetes mellitus. So why today means today is World Diabetic Day. So I want to talk about diabetes. Okay, not each and every point, just to summarize and about clinical things. Okay, from clinical point of view, we know there are two types of diabetes. What we know, type 1 diabetes and type 2 diabetes. Type 1 usually seen in young and type 2 is seen in adults, okay, or elderly, most commonly greater than 50 years of age. Okay, so another forms of diabetes also we have. Okay, these are the different types. Okay, ketosis prone type 2 diabetes, other specific types like monogenic diabetes, disease of the exocrine pancreas, endocrine disorders, drug or chemical induced, infection related, and other genetic syndromes. Okay, so and actually what will happen in this diabetes? So in type 1 diabetes, actually I said it will occur in young, means beta cells, it is type 1 is autoimmune. Okay, there will be beta cell destruction, so there is no insulin production from the beta cells, so pancreatic beta cells. So then after that, type 2 diabetes is more common than type 1 diabetes. So type 2 diabetes, there is insulin, but the receptors are not recognizing the insulin, so we are calling it as insulin resistance syndrome. Okay, so diabetes will affect leucine corner of our body. Okay, it affects all the tissues, so the patient may present with different manifestations, like he may go to ophtha and he may say I can't able to see clearly, like that, means he developed cataract. Okay, so or retinopathy, diabetic retinopathy, there will be disc changes in the retinopathy also. So then after that, he may go to ophtha, ENT, and he say I am not able to hear, and he may be in confused manner with deafness, and he may go to ENT with mucormycosis and everything. So then we will classify him as RCOM, rhinocerebrocular okay, disease. Then ocular mucormycosis disease. Okay, then he may again go to medicine department with varicose veins or ulcers, plantar ulcers. Okay, and he may go to psychiatry department with neuropathy complaints, means with confusion and irritant behavior he may go. So each and every department he will cause. Okay, this diabetes will cause this diabetes leads to these symptoms. Okay, so it is a main cause of death also. Okay, so due to these complications, natural history, agent, insulin deficiency is the agent. So in some pancreatic disorders like cystic fibrosis, inflammatory neoplastic disorders, we will see this diabetes. Okay, then decrease insulin sensitivity. Okay, due to decreased number of receptors, due to mutation in the insulin gene, autoimmunity, like that. Okay, and host factors, age, middle years to elderly. Okay, younger diabetes, the prognosis will be worse. Genetic factors also it is there. Twin studies shown that identical twins develop diabetes than dizygotic twins. Okay, so genetic markers are HLA B8 and HLA B15. So DR3 and DR4, this is these HLA genes are responsible for the high risk of type 1 diabetes. Okay, obesity, central adiposity, this is very risk factor of type 2 diabetes. Okay, weight gain, raised waist circumference, raised BMI, which will be greater than 30. These people are increased risk to diabetes, central obesity. Okay, and maternal diabetes during the pregnancy, gestational diabetes, which affects the children. Okay, the children presents with the large weight. Okay, and environment risk factors. And the offsprings who will be produced by the mother, uh, they will show IUGR and low birth weight. Okay, so uh, environment risk factors will be there, sedentary lifestyle and diet we are mostly taking junk foods, highly saturated fat. Okay, so it increases both glucose and insulin levels. Okay, and okay, unsaturated fatty acids from stable oil sources, like that we are taking it. Okay, so malnutrition. Okay, in PM in kwashiorkor, we'll see, this he will rely on the carbohydrate instead of the protein. So it may leads to diabetes, and it causes damage to beta cells. Okay, alcohol triggers the glucose and risk of diabetes. Okay, by damaging pancreas and liver. Some viruses like mumps, Coxsackie virus B4, like these agents, and chemical agents like aloxone, streptozotoxin, rodenticide, Valcor. These are the factors. And how to screen? What screenings we will do? Urine examination. We'll ask for urine test for glucose 2 hours after the meal. Okay. So then false positive also there, false negative also there. So probably this is not considered as appropriate tool. Blood sugar testing is OTT, oral glucose tolerance test. Will give 75 milligrams of glucose when the patient comes, and will mix it in water and ask him to drink. After that we will do this oral tolerance test. Okay, oral glucose tolerance test. So 75 grams of oral glucose. Okay, target populations are those who are in age group 40 and over, those with family history of diabetes, women who have a baby weighing for 4.5 kg. Okay, women who show excess weight gain during the pregnancy, patients with premature atherosclerosis. What are the preventions? How can we prevent? Primary prevention is there, secondary prevention is there. Primary prevention we will ask for controlling. So in this also we should see for risk factors. So high risk group and low risk group strategy. So in low risk strategy we will go with primordial prevention. So we will ask for avoidance of sweet foods, high intake of dietary fibers, and avoid junk food. Okay, these we will say for the patient, for the people. Okay, in high risk strategy, are sedentary lifestyle, overnutrition, obesity. These are the risk factors of diabetes. No, so we should ask them to reduce the factors that promote the atherosclerosis, like smoking, high blood pressure, elevated cholesterol, high triglyceride levels. Okay, in secondary prevention, so these are the values. Fasting value should be greater than 7 millimoles per liter, or 126 mg per dl. 2-hour post-load venous plasma glucose 200 mg per dl. 2-hour post-load capillary plasma glucose greater than 220 mg per dl. These are the values for diagnostic criteria for diabetes. This is recommended by WHO. HbA1c 6.5% or more. Okay, random plasma 200 mg per dl. Okay, so high risk strategy, these all. And secondary prevention, so to prevent the patient from going into the complications, to take regular medications, to maintain blood levels close to the normal limits, to maintain ideal weight. So treatment, diet, small balanced meals, diet and oral anti-diabetic drugs, glucose control. Okay, of blood glucose, these are. Okay, uh, glycosylated hemoglobin, as we saw. RBC lifespan is 2 to 3 months, so we should ask the patient for blood HbA1c for 3 months, once in 3 months. Okay, self care should be done. Okay, in case of any plantar ulcers like that, we should take care of the food through debridement, those all. Okay, and home blood glucose monitoring also comes under secondary prevention. Self care, optimum weight management, regular exercise for 45 minutes, and these all will help. So, interventions are lifestyle interventions for preventing type 2 diabetes in people of high risk. So, if we change the lifestyle, 35 to 58% incidence will be reduced. Metformin reduces 25 to 31% incidence in the diabetes. HbA1c, glycemic control in people with HbA1c greater than 9%, reduction of 30% of microvascular disease per 1% drop in HbA1c. Blood pressure control in people whose pressure is higher than 130 by 80, reduction in 35% of microvascular and macrovascular disease per 10 mmHg drop in blood pressure. Annual eye examination, reduction of 60 to 70% in serious vision loss. Food care in people with high risk of ulcers, reduction of 50 to 60% of serious food disease. AC inhibitors use, reduction of 42% in nephropathy, 22% drop in the cardiovascular disease. Tertiary prevention, so we should prevent the complications, okay, like blindness, kidney failure, coronary thrombosis, gangrene of the lower extremities. So these all we should see. Okay, that's all for today. So diabetes mainly I want to tell that first see your fasting blood glucose, like if it is like 70 to 110 it is okay. If it is greater than 126, so 110 to 126 impaired glucose tolerance, then you should take care of yourself. Greater than 126 is diabetes. So check your fasting blood glucose levels. We can't tell a patient may be asymptomatic having diabetes, so go and check your blood glucose levels. Okay, and 2-hour post-load venous will be 200. Random plasma 60 to 160 is normal. Greater than 200 is diabetes. Okay, so and HbA1c greater than 6.5, 5.7 to 6.5 is normal. So then so these plantar ulcers are common in diabetes, infections, and many amputations also going on because of this diabetes, gangrene, thrombophlebitis in some cases. Okay, eye problems, cataracts, anal cataract. These cataracts all diabetic cataract, retinopathy, neuropathy, nephropathy. These are all due to the diabetes. So the thing is to control our things by doing morning regular exercises, taking good health, good nutrition, and this is our take home message. So daily you should do exercise for at least 30 minutes for yourself, and morning walk, and eating high fiber diets. Okay, and expressing your emotions freely and avoiding stress in your studies. Okay, that's all guys today. Thank you. Happy all diabetes day. Why I'm saying happy, because after this video we are all going to follow these measures, and we are get rid of our of diabetes and maintaining our good health. Okay, thank you guys.